This talk is how to prepare for National Board of Critical Care Echo or CCE exam. My name is Walid Al-Habashi. The objectives of this lecture, I will go through a quick disclosure, then I'll introduce myself, show you what is the exam setup in the Critical Care Echo exam, what's the exam content outlines, exam resources, either reading or MCQ resources you can use to improve your knowledge and MCQ answering skills. Then we'll go quickly after that on some tips and tricks about the exams. Disclosures, I have a book in Critical Care Echocardiography. It's under publication now in Egypt. I am teaching online course and I actually purchased the American course of Critical Care Echo Preparation course, but I'm not disclosing any of the content of that course. I'll just show you the outlines, but I'm not going to share any of the content of the course in the moment. I believe none of these is related to this lecture actually, but just to disclose it. As I said, my name is Walid Saad Al-Habashi Ali, or going with Walid Al-Habashi. I graduated from, I got my medical degree in 2000 from Tanta University Hospital and got the master degree in anesthesiology in 2006. I passed both European Diploma of Intensive Care and Anesthesia and Intensive Care in 2013 and 2015. I earned the Arab Board of Anesthesia in 2015. I earned the fellowship of the Irish College of Anesthesia in 2017. I earned my MD in anesthesiology from Tanta University Hospital in 2018. I'm currently a testamer of the National Board of Critical Care Echocardiography in last January. I actually finished as well, almost the same timing, the Diploma of Healthcare Simulation and Patient Safety from University of Galway in Ireland, National University of Galway in Ireland. I'm currently an SCM International faculty and I'm a FICE mentor in Ireland and UK. I teach with multiple societies like the FICE, the WinFocus, the American Society of Critical Care Medicine, overseas in multiple countries. And I am one of the very few mentors of the FICE faculty in Ireland. Maybe 4 or 5, I'm not really sure about the exact number. Now, after you know me, the exam setup, this National Board of Critical Care Echo in the one I passed in January is just multiple choice questions. And I believe the 2021 will be the same, just multiple choice question. There is no multiple true false, just MCQ. Select the best answer. These 5 sections, each section is 54 minutes. So it's around 5 hours exam with a 30 minutes break. You can divide your breaks into 6 minutes 5 times, or just take 30 minutes all together. It's 40 questions in each of your sections, total of 200 MCQs. Much or the most of these exam questions is focused on interpreting ultrasound videos, either video clips or images. I think there's just very few exam questions coming in a just text format, and they're talking about physics or physics equations. The test allows you to adjust the video clip magnification, contrast, resolution of the image. So these are all software tools. And once you registered for the exam, you will have the ability to use a test trial, giving you 10 MCQs and giving you the ability to test your abilities to control the magnification, the contrast, the setup of the exam, to familiarize yourself. And if you didn't do that, don't worry, you will have 15 extra minutes, 15 or 20, I don't remember exactly, to do that before the test. So if you didn't, but I strongly recommend you do that online as a preparatory session before you go to the exam prometric center. So exam content outline, sorry. This content is actually from the National Board of Critical Care Echo. Is nothing I made myself, so it's available online. If you wish, I'm just highlighting few parts. So if you see here, I started by number 3. There's 1 and 2, but they're coming in the next slides. I started by number 3 because it is the equipments, physics, artifacts, image acquisition. You will find you have a psychological barrier against physics and artifacts, but believe me, these are the only questions guaranteed. It represents like 10 to 15% of the exam questions. Please make sure that you guarantee 100% all the questions of that kind before you sit the exam, because other clinical questions are so tricky. And these really make a lot of difference. So it's easy questions if you know what they are talking about. So physics, they are talking about the different types and modalities of the exam physics: 2D mode, Doppler ultrasonography, M mode, contrast, pulsed wave, continuous wave, what's the difference between pulsed and continuous waves, when to use this and that. All this is related to physics, and there is a lot of MCQs about that one. I will show you how to get these questions and train yourself doing them. Artifacts, there is more than 10 or 12 artifacts. This is just few examples of them, like reverberation artifacts, side loop, mirror image, acoustic shadowing, aliasing, electrical interference. Like, this is just 6 examples. I think there is 10 or 12 types. You have to train yourself. Again, it's not, don't take that lightly. It's very important. It's guaranteed exam questions. So don't bypass it, don't take it lightly. I cannot stress that enough, but please take care of these artifacts. At least 4 or 5 exam questions are coming from the artifacts. Image acquisition, how to position your probe, how to manipulate the probe, probe selection, image acquisition in every indication, how to optimize the image. And in my handout, I have a dedicated section for how to gain and optimize your image properly and how to position the patient properly. Cardiac versus abdominal presets, I didn't really see any exam questions in that point, but again, this is very important. I cannot stress that enough, as I said. Here, let's go now with the anatomy. So they will ask about the anatomy, but it is not the National Board of Echo for Cardiologists. So it is focusing on the critical care segment of it. You have to be a critical care mindset. You have to have the critical care mindset. So systolic functions, quantitative versus qualitative, yes, you need to know both. Diastolic dysfunction, definitely. Chamber quantification with different modalities, yes, Simpson method, 2D, M mode, the masses and thrombi, you have to diagnose them, don't miss them. Different types of cardiomyopathies, ischemic cardiomyopathies, dilated cardiomyopathies, the RV assessment, all this structural assessment, valvular heart disease, they focus mainly on the aortic and mitral. I think to my, what I remember, like I'm not disclosing any exam questions, but the tricuspid, pulmonic, and endocarditis may be 1 or no questions. So it's area of less interest for us from critical care point of view. Prosthetic valves and valvular dysfunction, yes, definitely. Again, atria may be about left atrial appendage assessment by transesophageal echo and thrombi and the velocity inside the thrombus. This is basic knowledge for any of the critical care physicians. You need to know about the functional anatomy very well. So as you see in the functional anatomy, A, B, C, D, and E here, so you'll go the pericardium, the great vessels. There's a good number or good focus on the great vessels, on the aorta, IVC, and SVC. As you know, these are the cornerstones in the management of a critically ill patient. Devices, again, there is a good focus on this one because it's practical point. You need to know what are the types of catheters. Is the pacemaker with a cardioverter device, where that lies? Is there any image optimization? Is that an Impella device or whatever? And you need to adjust ECMO, cannula, is it the proper position or improper position? So you need to fulfill all this knowledge before you sit the exam if you're keen to get most of the exam questions answered in the right way. I shared with you this handily written comments on this one because I have like the best source discussing each of these content. So I studied maybe 7 or 8 resources or from like maybe 6 or 7 sources different. So I believe, for example, left ventricle and right ventricle, if we're talking about masses, the best source was the American Society of Critical Care Medicine lectures. And here, for the constrictive pericarditis, I've done that via 1 to 3 sonography handout and video lectures. So there is a lot of sources. I believe they are complementary. There is no best source. Here, this is extremely important slide. This is the critical care echo or critical care ultrasound you are expected to know 100% about. So types of shock and shock management, is it cardiogenic, distributive, hypovolemic, and how to distinguish everyone, obstructive, how to assess for fluid responsiveness and volume assessment, acute cardiovascular presentations like myocardial infarction, regional wall motion abnormalities. They don't really go in details with the 17 segment model and ask about the culprit lesion. This is not in your curriculum, but you need to say if there's any regional wall motion abnormalities or not. Definitely pulmonary embolism and aortic dissection, valvular heart disease, if there's any moderate or severe valvular heart disease lesions, how to quantify that in the term of quantitative and qualitative assessment. So you need to know that cardiomyopathies and different types. Congenital heart disease is really basics. So like ASDs, VSDs, and that's it. Like, don't focus on spend more time on the congenital heart disease. It's not as important as the physics or the hemodynamics. Definitely trauma, either blunt trauma or penetrating trauma, heart failure, respiratory failure, cardiac or respiratory origin. Cardiac arrest, definitely there is a rule of echocardiography in cardiac arrest, multiple rules, and there is precautions as well. So you need to focus on echocardiographic importance of cardiac arrest. What's the value and what are the precautions? Integrated ultrasound imaging, which is a good number of questions, maybe again 20% of the exam questions are focusing in this point, which is not expected from a cardiologist to know, like lung ultrasound, diagnosing of different pneumonias, pleural effusions, pneumothorax. If you have a PE, what is the blue protocol? Going to the vascular ultrasound, looking in the DVTs, you may find few exam questions about DVT. Is it positive or negative for DVT? How to evaluate for hypovolemic shock and abdominal fast or extended fast examination. So these are all the curriculum which is published online, nothing confidential about it. I'm not disclosing any of the questions here. So this is how you should prepare yourself and what's your mindset doing that one. So the materials preparing for the exam, there is reading materials and there is MCQs. Reading materials, the most precious source, to my opinion, as a critical care ultrasonographer or critical care echocardiographer or a critical care physician interested in ultrasound and echo, is the comprehensive critical care echo by Samuel and colleagues by the American Society of Critical Care Medicine. I given this course 5-6 times in United Arab Emirates, and that's the handout of the course. This is very valuable course. If you can take it or if you can attend it anytime, please don't miss it. There is basic and advanced versions of the course. If you have any of these courses available, don't miss it. It's very valuable courses. This is by Thomas Binder and George Echo Facts, this is by 123 Sonography. That was the very first course I did. It's cardiology based or cardiology oriented course, but it's really very comprehensive. The handout is fantastic. It's very nice handout. And that's my echocardiography handout, which I give during my course as supplementary materials. It contains my ideas and how I think about critical care echocardiography, and it's all my opinions and how I think about a patient in critical care or critically ill. And this is available upon request from myself. It's under publication now in Egypt, so soon after Eid, inshallah, it will be available in one of the distributors. This is a critical care echocardiography review course. It's for the non-members is like 1,200 US dollars, and for the members, the professional members, is 1,000 euros. Sorry, $1,000. It's a very valuable course. It's 3 days course. Content of the course is I would consider this is the software and technicalities and how the course will run. So the actual sections is section 1, 2, and 3 is talking comprehensively from critical care point of view, not from the cardiologist point of view. I can share the content, or you can look at the content online if you are a member of the American Society of Critical Care Medicine. And the nice thing about this one is it's not just knowledge discussion. They are going in a board exam questions in multiple sessions. So they are discussing the questions. So it's an interactive based learning. So you answer the question, and if it's wrong, they will go and explain what is the right answer and why you selected this right answer. Again, I'm not disclosing anything about that course or not discussing any exam questions, but it's like, for example, in section 2, you find shock, and they describe the shock in a very good way. Cardiac arrest, what is the values, what is the importance, vascular ultrasound, abdominal ultrasound. All these are not available really in the national board courses of echocardiography, which I did. I took all the courses in critical care echo and cardiology echo courses from the American board or whatever. So it's really different exam. They are talking about devices and foreign bodies. Like this, the setup of this exam was really focused on the National Board of Critical Care Echo. So I got a good benefit of that course. Now the MCQs, how to prepare. Now I have the knowledge. I don't have enough time to get more knowledge. I wouldn't advise that. You have to prepare knowledge plus exam. But if you are really tight in time and you're short in time and you just need to go to the MCQs, what is the exam MCQs sources? I think this is one of my best or highly recommended sources of MCQs. That's the Echocardiography Board Review 500 Multiple Choice Questions by Pai and Padmini. Second source is Anki. This is an application of flashcards type questions. So you just download this app from anywhere, it's for free. And once you download that, you fill it with the flashcards. And I have a lot of free going flashcards. I'm not disclosing any confidential flashcards or any paid sources. So it's available, prepared by different colleagues all over the world, from China, from Japan, from Europe. And it's personal efforts, so it's not in the market for paid, but unfortunately they are not known. So they are known here in Europe, and a lot of people are using this Anki application. And I have used my 1, 2, 3 sonography exams, which I did like 3 years back, but I still have a copy of my exam results. So I reviewed the exams as well. So how the Anki flashcards work. So this is an example. This is the application. If I give you these flashcards, you will find here it is sub-classified into physics, pericardial, measurements, M-mode, hemodynamics. So there is sub-classification. So you select one, or you can select the whole collection, and then it will give you how many questions in this one. And once you have that, you go to answer. So they will ask swirling effect and poor LV opacification with echo contrast is due to what? So it's not an MCQ type questions, but it's very nice for brainstorming. Then you can use this way and then see the answer. So it's the answer is the mechanical index being set too high. So this is the answer of that question. So you can hide the answer and then try to do some brainstorming after you study. And then after that, you will get the answer. Or you can click the box down here, show both sides, and then you can have the question and answer if you're studying primarily. So if this is your first time to study and you don't want the brainstorming, so just press this one, show both sides, so you'll see the exam question and the right answers. Or you can hide this, untick this box, and then you will find the exam question and you think about the answer, then go by this blue arrow and see the right answer. So it's kind of two different setups of the exam, how you take the exam. So and it's for free, so it's very helpful. Now, tips and tricks. Really, your experience matters. So follow your gut feeling when you read the exam stem, the question stem, you will say, this is talking about this and that before you read the answers. This is the way how you answer the prometric exams of USMLE. This is how you answer any prometric type questions. So read the stem first. That's my advice. It's not thing written in anywhere, but this is my advice. Quickly go through the exam question stem quickly. Then he is talking about what does he want from this question. Then go and read the exam answers quickly. And I think by this stage, when you are writing, you are trying to find the proper answer in your mind. If not, try to read the stem again, finding what could match with answers. This will cost you some time. So again, every question is 1 minute and 20 seconds. So you have to make use of time. If the stem of the question is too long, now you can mark this question and leave it, bypass it. Don't spend 3 or 4 minutes in just one question. You're wasting your time. So this is the exam strategy in prometric exams. So the best strategy is, if it's short exam question, no mathematical calculations required in this exam question, and you think it will be easy go, okay, you take your decision or make your mind in this first go. Otherwise, very long scenario, comprehensive answers, like every answer is one line, one full line, and you will find that this question is taking more than a minute from yourself. Just mark the question and bypass it, because you may spend 3 minutes on this exam question and at the end you get it wrong, so you lost 2 questions for nothing. So at the end of the exam, 54 minutes for each section, you will find you solved, like if we are taking about 40 exams, you finished 37 and there's remaining 3. If you have time, you have time. Go and read them, try to answer them. If you don't have time for them, okay, you lost 3 questions. So this is the exam strategy I would strongly recommend. Number 2, about tips and tricks, physics and artifacts. As I said, never, never, never sit the exam, please, without knowing physics very well, artifacts extremely well. You're not gonna pass the exam without them, because the clinical questions are so tricky. So if you lose physics and artifacts and you lose good number of clinical questions, you're not make it. You're not gonna make it. So please focus on physics and artifacts, but don't give it all the time. It's not what I'm saying. But we are usually clinically clever enough to spot most of the question, because most of you now is in the field of critical care echo. So you are doing critical care echo every day. So I think knowledge-wise about the critical care echo is 70 to 80% with most of you. But physics and artifacts is a very weak point for everyone, because we are not sitting the exams. So if this is your first exam, and I believe most of you, this is your first exam, so this will be your weakest point. So try to strengthen your weakness before sitting the exam. This is what I'm trying to say. Image acquisition is guaranteed questions. don't miss it again. Hemodynamics, a lot of questions about hemodynamics. They consider this is the main point of examining you. All your patients are hemodynamically unstable or respiratory unstable. So it's either hypoxia or shock. So don't be surprised if you find 60 or 65% of the exam questions scenarios are about shocked patient or hypoxic patient, because this is our real life. Lungs and pleura, there's a good amount of questions talking about all types of pneumonias, ARDS, effusions, the dynamic and static pattern, or air bronchogram, dynamic air bronchogram and static air bronchograms, spine sign, curtain sign, all the signs. So lungs and pleura has a good share in this course or in this exam. Valvular, okay, as I said, aortic and valvular has the main share because tricuspid and pulmonary is not that important in our real life, but they are important. And tricuspid is mainly you're detecting the TR associated with the pulmonary embolism or accompanying pulmonary embolism. Congenital heart disease, stick to the basic ASDs, VSDs, the main or the well-known congenital heart diseases. Transesophageal echo, there is few questions, but again, I think a lot of people are afraid to sit this exam because they are critical care physicians. They are not really aware what is a transesophageal echo indications. So focus mainly on the theory of the transesophageal echo. What are the indications? What's the absolute and relative contraindications? And that's available in everywhere by the American and European heart associations. So you can find this one and know the basic views, know the basic, like if you are talking about left atrial appendage thrombus, position of the impella, cannulation of ECMO. This is essentials to know because you are a critical care physicians. There is no transesophageal echo in anesthetic. That's not part of your curriculum. So don't bother yourself about intraoperative management of valvular heart disease pre and post implantation of the valve. This is, I didn't see that myself. I don't think that there is any concern or interest in that exam questions. This is my share on what I know about the exam and what's my advice. And I'm giving all this advice again as an SCM faculty, as vice mentor, on my personal basis, nothing related to the exam questions I sat last January. I didn't disclose any of the questions I faced or I found. I didn't write any questions. So